Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined today by Betty Fung and Stacy Goldsby, both with the San Mateo County Health System. Betty and Stacy, thank you for joining me. Rather than taking our 10-minute interview and spelling out the titles, your titles, I thought I'd let you do that and then also tell us what is it that you do and a little bit about the program that we're talking about today. So we'll start with you, Betty.
Okay. So I am the Registry Supervisor. I oversee the in-home care provider registry for the public authority, which is part of the in-home supportive services in the San Mateo County Health System.
And we're going to talk about the registry itself in just a little bit, so they'll understand what a registry specialist does with regard to the registry. And Stacy, you do the training for the program, so tell us a little bit about your title and what you do.
So I work with Betty. I'm the training specialist with the Public Authority for In-Home Supportive Services. And I coordinate workshops and trainings that our IHSS or In-Home Supportive Services providers can attend. They're free, and we offer topics ranging from diabetes to personal care. And it's an opportunity for our providers to come together in a shared space to get some great information from community experts.
And when you talk about your providers, you mean the individuals that you are training to then go into homes to provide supportive services. Tell us about the client, if you will. Who are they and how are they finding you to get on the registry or to be part of the program?
So basically, in-home supportive services is a Medi-Cal program, which is for seniors aged 65 and over and individuals with disabilities, and that will, that could include children with disabilities.
Right. So basically, it's the Medi-Cal category, if you will.
Yeah, and it's a program that's unique to the state of California. It allows individuals, Medi-Cal in-home supportive services recipients to hire somebody to care for them in their own homes so that they could remain there safely.
Right. And obviously, you are then training the folks who are interested in being that in-home caregiver.
Right. So they, part of their orientation, they have to come to a mandated orientation for all new providers that are coming to work for the program. But in addition to that, we have opportunities for non-mandatory, it's optional, for them to attend trainings throughout the year that I coordinate on different topics. So they have an opportunity to take workshops on many, many topics throughout the year in their course of working as an in-home provider.
I would imagine if I look at San Mateo County, we all know that our population is aging. Wonderful news, we are growing old in place, and we are growing older, so that's the heroic news. We're taking better care of ourselves, we have access to better care, we're living longer. The other news to celebrate is that we are aging in place. So we are allowing for our families, our grandparents, our great-grandparents to stay in their home. And this is such a wonderful program that Medi-Cal is offering to its recipients. Now, there is a need. As we have greater and greater clients and greater need, you have greater and greater need for people to be providers. So tell us a little bit about what you're trying to do and how you're trying to get the word out to let folks know that perhaps if you're looking for a second or third career or something that you'd like to do towards the beginning or end of your career, this might be a spot for you.
Yeah, so as you mentioned, Dani, our population is aging and the caregiving industry, it's forever growing, especially in this particular county. And so within the county, about 90% of the in-home supportive services clients hire their own families or friends to care for them. But that still leaves us with 10% who don't have anybody who could care for them, and so they are the ones who come to the in-home care registry asking for help to be connected to a caregiver. And so we are here to recruit more providers into the registry so that when clients come to us, then we could be referring them to these clients.
And tell us a little bit about what are some of the functions that the in-home caregivers will do.
Well, the state, this is a Medi-Cal program, so the state put the framework of the type of duties and tasks that they can do and be paid to do in the home setting. And they range from services such as personal care, helping someone dress for the day, bathing, personal care, cooking, like meal preparation, cleanup, helping them domestic services, medication reminders, assisting someone to transfer through the house. Maybe they're in a wheelchair or using some assistive device and they need some assistance from getting out of bed to ambulate, to walk to the dining table to have lunch.
Right.
So it's, many tasks that can be done in the house, and also if they need to travel to accompany them to a medical appointment, there are some assistance that can be provided in the service plan, the care plan for that.
I think what I'm hearing from you too is that I love that we shouldn't all assume that we don't have the skills to help someone in home, and what an honorable thing to be able to help someone live a glorious, joyous day. And even just that companionship that should bring a smile to someone's face, to just be checking in with them and some of their simple duties. I know in our family, in our history, Italian history, it's hard for my parents to accept help.
Outside help.
Right? And so to have a caring, loving person come in and just be there to be supportive. What do we want to make sure that we tell our community? We're going to tell them how to contact you if they are interested. What are the hours like? Are they flexible? Do you need people 40 hours a week? Is it a 12-hour shift?
So one of the perks in working through the registry is that there's major flexibility in this line of work. You could basically pick where you want to work, when you want to work, and whom you want to work for. And so, there are students, nursing students who be coming in saying that, I want to just,
Supplement my, right.
And supplement my tuition.
Right.
And so they could be giving, 10, 20 hours a week, and it could be weekend, it could be evenings, it could be during the day, whatever works for them. And then, and they could tell us, oh, I only want to work in San Mateo and Foster City, and,
For transportation issues, right.
So it's totally flexible. And that really also helps to build up people's, resume as a caregiver.
Right.
If they want to go into that line of work.
And do you only provide, do you only work with folks in home, or do you also provide nursing facilities with trainees or with providers?
Well, the trainings, the workshops are only offered to currently working IHSS providers, so they have to be active providers in the system working for the program. So our trainings happen in San Mateo. We offer them at the medical center. We have a training lab of sorts, so we can kind of set up a patient room to simulate a home apartment, and so people can get the experience and the familiarity of what it may be like going home. And that's a great partnership that we forged with the rehab department at the medical center, at San Mateo Medical Center. So they also use it for patients who are coming to their clinic to prepare for discharge home. So we both share the space.
And then to piggyback on your original question too, all of these providers would work in the client's homes. And they won't be working in any facilities. It will all be in-home supported services in the client's homes.
So Betty, I think you're kind of like the matchmaker.
In a way, yes.
You're matching someone's personality, skill set, ability to hours to work with that person in home to ensure that it is just the right fit.
Yeah, and we've had quite a number of success stories that it's really like heartwarming.
I would imagine.
We've had I can remember a client who has been diagnosed with dementia. He lives alone in Half Moon Bay, and he was often found wandering on the streets and not being dressed or properly, or he's not eating properly. And then we were able to get a caregiver in, working with him every day, and now he has been so stabilized, and even we receive positive feedback from the community saying that we're just so glad that he's being taken care of.
Thriving.
Yeah.
Well, thank you so very much, both Betty and Stacy, for coming and sharing your story. We hope that there is tremendous amount of calls and inquiries that you now get once this program airs, to people to understand what a need and what a great honor it would be to provide our seniors in-home care and make this county as great as it always has been. Thank you so much for joining us.
Thank you for having us.
And we'll make sure that all the information gets posted up at the end of this program.
Awesome.
And we'll see all of you next time on Penn Voice.